Welcome to Per Channel. What if I told you that right now, as you're listening to this, your body could be sending you silent distress signals that most doctors miss for years? Imagine visiting 5 different specialists, trying dozens of treatments, and still not knowing what's really going on. That's the reality for millions of people living with an autoimmune condition that hides in plain sight. Here's something that might shock you. There's a disease that takes nearly 5 years on average to diagnose properly. 5 years. That's over 1,800 days of confusion, frustration, and symptoms that keep getting brushed off as stress, aging, or just bad luck. And here's the twist. It affects 9 out of 10 women, usually striking between their 40s and 60s, though honestly, it doesn't discriminate by age. But here's what really gets me. The early warning signs are so subtle, so everyday, that people ignore them until the damage is already done. Now, before we go any further, I need to be completely transparent with you. Everything I'm sharing today is purely educational. This isn't medical advice, and I'm not here to diagnose anyone. If anything I describe resonates with you, please talk to a qualified healthcare professional. They're the ones who can run the proper tests and give you personalized guidance. What I can do is arm you with knowledge that might save you years of confusion. So let's talk about Sjogren syndrome. You might not have heard of it, but trust me, it's more common than you'd think. The medical community actually calls it the Great Pretender because it's a master of disguise. Its symptoms masquerade as 100 other things. Dry eyes? You've been staring at screens too long. Persistent fatigue? You're just stressed. Dental problems? You need to floss more. See how easy it is to miss? Today, I'm breaking down 12 warning signs that could be your body's way of waving a red flag. By the time we're done, you'll understand what to look for, why these symptoms matter, and most importantly, when it's time to dig deeper. So let's get into it. Starting with something that sounds complicated, but affects everyday life more than you would imagine. Your body has this incredible system called the autonomic nervous system. Think of it as your internal autopilot, controlling everything you don't consciously think about. Your heartbeat, your blood pressure, your digestion, all of it runs on autopilot. Now, when Sjogren's attacks this system, things get really interesting, and not in a good way. Here's what happens. Research shows that up to 60% of people with Sjogren's experience something called dysautonomia. That's just a fancy term meaning their autopilot is malfunctioning. And the scary part? Most people don't connect the dots because the symptoms seem random. Picture this. You stand up from the couch and suddenly the room starts spinning. Your vision goes dark around the edges, your heart starts racing, and you have to grab onto something to avoid hitting the floor. That's not just getting up too fast. That's your body failing to adjust your blood pressure and heart rate the way it should. Some people actually faint from this, which is particularly dangerous for older folks who could seriously injure themselves in a fall. Then there's the heart stuff. Your heart might start pounding like you just ran a marathon, except you only walked to the kitchen. You might notice your heart rhythm feels off or you get exhausted from activities that used to be no big deal. Studies have found that people with Sjogren's, especially those with autonomic issues, face higher cardiovascular risks. That's not something to brush off. And it doesn't stop there. Your digestive system goes haywire too. One day you're constipated, the next you're dealing with the complete opposite. You're bloated, uncomfortable, and your stomach empties slower than it should, leaving you feeling full and nauseous hours after eating. Even your bladder gets involved. Suddenly you're rushing to the bathroom constantly, or you feel like you can never quite empty your bladder completely. Interestingly, research suggests men with Sjogren's might actually experience worse cardiovascular symptoms from this autonomic dysfunction, though it can hit anyone hard. The key here is recognizing that these seemingly unrelated symptoms, the dizziness, the heart issues, the digestive problems, they might all be pieces of the same puzzle. Moving on to something you can actually see, your skin. We all deal with dry skin sometimes, right? Winter comes, humidity drops, you slap on some lotion and call it a day. But what we're talking about here is different. This is dry skin that doesn't quit. The medical term is xerosis. And when Sjogren's causes it, your skin doesn't respond to normal moisturizers the way it should. We're talking about skin that feels rough, almost like sandpaper. You've got scaling and flaking across your arms, your legs, your torso, and the itching, oh, the itching gets worse at night when you're trying to sleep. You scratch, which breaks the skin, and then you're dealing with infections on top of everything else. Your skin's protective barrier breaks down, making it react to things that never bothered you before. Soaps, detergents, fabrics, suddenly everything irritates your skin. But here's where it gets really interesting. Sun exposure might trigger these strange red, scaly rashes. They pop up on your face, your neck, your arms, basically anywhere the sun hits. Some people develop these circular rashes that spread outward while the center clears up, creating this bullseye pattern. Now, unlike some other symptoms of Sjogren's, the skin problems don't really differ between men and women. Both sexes need to pay attention if their dry skin persists despite doing everything right, especially if they're seeing these sun-triggered rashes or unusual circular lesions showing up. Let me describe something that sounds like it's straight out of a medical drama. Imagine your fingers suddenly turning ghost white, then blue, then bright red, all in the span of minutes. That's Raynaud's phenomenon, and it affects somewhere between 30 and 50% of people with Sjogren's. Here's what's happening. Your tiny blood vessels in your fingers and toes go into spasm, usually triggered by cold weather or stress. Blood flow stops. Your fingers turn white. Then they turn blue because the trapped blood loses oxygen. And finally, when the vessels relax and blood rushes back in, they turn red. And let me tell you, that last phase hurts. People describe burning, tingling, numbness. It's not pleasant. These episodes can last anywhere from a few minutes to several hours. During that time, you can't feel your fingers properly, you can't do detail work, you can't even hold a cold drink without triggering an attack. In severe cases, if this keeps happening over and over, you can develop ulcers on your fingertips or even tissue death, though that's rare. Here's why this matters beyond the obvious discomfort. When Raynaud shows up alongside Sjogren's, it often signals that the disease is affecting more than just your glands. Studies indicate that people with both conditions have higher rates of lung and kidney complications. It's like your immune system is launching a broader attack. Women experience Raynaud slightly more often, which tracks with general autoimmune patterns, but men who develop it might face more severe vascular complications. Either way, if your fingers are doing this color-changing act, especially if you're experiencing other symptoms we're discussing, that's a sign to take seriously. Now, let's talk about a symptom that drives people absolutely crazy, a cough that just won't quit. Not a productive cough where you're bringing stuff up, but a dry, irritating, exhausting cough that seems to have no purpose. Sjogren's attacks the moisture-producing glands in your respiratory system, drying out your airways from your throat down to your lungs. Without that protective layer of mucus, everything irritates your airways. Dust, perfume, cold air, it all triggers this persistent cough. And it gets worse at night when you lie down, which means you're not sleeping well on top of everything else. This isn't your typical cough that clears up in a week or two with some over-the-counter medicine. This is chronic. It sticks around month after month. Some people develop chronic bronchitis because their airways stay inflamed without the protective mucus they need. Others develop something called bronchiectasis, where the airways actually become damaged and widened from ongoing inflammation. Here's something that really caught my attention in the research. Men with Sjogren's appear to develop more severe respiratory complications than women. They have higher rates of interstitial lung disease, which affects the tissue surrounding the air sacs in the lungs, and something called bronchial hyperresponsiveness, where the airways overreact to irritants. This gender difference means everyone needs respiratory evaluation, but men might face higher stakes and need more aggressive monitoring. If you've got a persistent dry cough that's been hanging around for months, doesn't respond to typical treatments, and especially if it's accompanied by other symptoms we're discussing, that's not something to ignore.
Let's talk about the symptom most people actually know about when it comes to Sjogren's: dry eyes. But here's the thing: most people dismiss dry eyes as no big deal. Too much screen time, getting older, seasonal allergies. There are a million easy explanations. And that's exactly why this symptom gets missed for so long. The medical term is keratoconjunctivitis sicca, which basically means inflammation of the cornea and conjunctiva due to inadequate tears. But it's not just about quantity. Research shows that people with Sjogren's produce tears that have the wrong composition. The quality is off, not just the amount. So what does this feel like? People describe a burning, gritty sensation, like there's sand trapped under your eyelids. Your eyes look red and bloodshot. They feel sticky when you wake up in the morning. And unlike temporary dry eyes that get better when you get out of the wind or turn off the air conditioning, this persists all day, every day. It actually gets worse in air-conditioned spaces or windy conditions. Now, if this goes untreated, it's not just uncomfortable. It can progress to serious complications. We're talking about defects in your cornea, scarring that affects your vision, and in rare, severe cases, even perforation of the cornea. That's as serious as it sounds. Here's an interesting pattern. Women report dry eye symptoms about 9 times more often than men, but studies suggest that men might not report early symptoms as readily, and when they finally seek help, they often present with more advanced eye damage. So guys, if your eyes are bothering you, don't tough it out. Early recognition and treatment matter for everyone. Moving into your mouth now, and this is where things can get really problematic really fast. Saliva does way more than just keep your mouth moist. It's your first line of defense against bacteria. It helps you digest food. It protects your teeth. It's basically liquid armor for your oral health. Take that away, and things deteriorate quickly. People with Sjogren's develop cavities at 3 times the normal rate. These aren't your garden variety cavities that take years to develop. We're talking aggressive decay that hits multiple teeth at once, even if you're brushing and flossing religiously. The decay shows up in weird places too, like right at the gum line instead of on the chewing surfaces where you'd normally expect cavities. Without saliva's antimicrobial properties, your mouth becomes a breeding ground for problems. Thrush, which is a fungal infection, becomes common. It shows up as white patches that you can't wipe off, and studies show up to 60% of people with severe dry mouth deal with recurring infections. The pH balance in your mouth shifts, the bacterial population changes, and your teeth and gums suffer the consequences. Both men and women face equal risk when it comes to dental complications from Sjogren's, though women might seek dental care sooner, potentially limiting the damage. The big warning sign here is sudden, multiple dental problems appearing despite good oral hygiene, especially when combined with persistent dry mouth. If your dentist is suddenly finding cavity after cavity and can't figure out why, this might be the reason. Let's move up to your nose and sinuses. You know how your nose is supposed to stay comfortably moist inside? There's this protective layer of mucus that traps bacteria, allergens, pollen, all the junk in the air before it gets deeper into your respiratory system. Sjogren's dries that out, and suddenly your first line of defense is gone. About 40% of people with Sjogren's develop chronic rhinitis, which is significantly higher than you'd see in the general population. What does this feel like? Constant dryness and crustiness inside your nose, frequent nosebleeds because the tissue is so dry and fragile. The mucus you do produce becomes thick and crusty, hard to remove, and painful when you try. Chronic sinusitis sets in because without proper mucus and drainage, your sinuses can't clear themselves the way they should. This isn't like a typical sinus infection that responds to antibiotics, though. Cultures often come back negative for bacteria, but you still have facial pressure, headaches, and congestion that won't respond to decongestants. Some people lose their sense of smell partially or completely, which affects taste and overall quality of life more than you'd think. Studies show nasal symptoms affect men and women pretty equally, but the hallmark is persistence. If you're dealing with nasal dryness, nosebleeds, and sinus pressure that just won't quit, despite treatment, especially alongside other systemic dryness, that's your clue. Now we're getting into the digestive system, and this is where it gets complex because Sjogren's can mess with your gut in multiple ways. Research indicates that up to 70% of people with Sjogren's experience significant digestive problems, and often these symptoms show up before the classic dry eyes and mouth. Remember how we talked about saliva being important? Digestion actually starts in your mouth. Without enough saliva, food doesn't break down properly, and you don't have enough buffer against stomach acid. This leads to severe gastroesophageal reflux disease, heartburn, and this sensation of food getting stuck in your throat. The acid that comes up can damage your esophagus more easily without saliva to neutralize it. Then there's gastroparesis, where your stomach doesn't empty the way it should. This ties back to that autonomic dysfunction we talked about earlier. Your stomach just sits there holding on to food for hours, making you feel bloated, nauseated, and sometimes triggering vomiting. This often goes undiagnosed for years because doctors don't connect it to an autoimmune condition.
Here's something really serious. Some people with Sjogren's develop autoimmune pancreatitis, where the immune system attacks the pancreas. This causes chronic inflammation, loss of digestive enzymes, and increases your risk of developing diabetes. These are not minor complications. Interestingly, women tend to report gastrointestinal symptoms more frequently, though whether that's due to hormonal factors, different healthcare seeking patterns, or actual physiological differences isn't entirely clear. What is clear is that both men and women can develop serious GI complications that need specialized care. For women specifically, there's a symptom that's often overlooked or dismissed as just a natural part of aging or menopause: vaginal dryness. But when it's caused by Sjogren's, it's typically earlier and more severe than normal age-related changes. The majority of women with Sjogren's experience this because the autoimmune process doesn't discriminate. It attacks moisture-producing glands everywhere, including the reproductive tract. The tissue becomes thin, fragile, and inflamed, causing burning, itching, and constant irritation. The pH changes, which increases the risk of yeast infections and bacterial vaginosis that keep coming back despite treatment. This leads to dyspareunia, painful intercourse. Reduced lubrication and fragile tissue make intimacy uncomfortable or impossible, which strains relationships and tanks desire. Research shows women with Sjogren's report significantly lower sexual satisfaction and quality of life, especially after menopause, when hormonal changes amplify the symptoms. The good news is that early intervention with lubricants, moisturizers, or hormonal therapies can make a huge difference. But women need to feel comfortable bringing this up with their doctors, and doctors need to ask about it because many women suffer in silence, thinking it's just something they have to live with. Now, for men, there's an equivalent issue that's just as impactful but often flies completely under the radar: chronic prostatitis. This is inflammation of the prostate gland without any bacterial infection, creating persistent pelvic pain and urinary symptoms that can last for months or years. Men with Sjogren's develop this at significantly higher rates than the general population. But here's the problem. Most urologists don't immediately think about autoimmune causes when they see chronic prostatitis. So men end up on round after round of antibiotics that don't help because there's no infection to treat. The pain can be deep and radiating, shooting into the lower back, testicles, or thighs. It gets worse with sitting, physical activity, or stress. Urinary symptoms include constantly feeling like you need to go, difficulty starting the stream, and getting up multiple times at night. Sexual function takes a hit too, with painful ejaculation, decreased libido, or erectile difficulties. This condition can be the presenting symptom that actually leads to a Sjogren's diagnosis in men, especially for guys who might brush off milder symptoms like slightly dry eyes or mouth. If you're dealing with chronic pelvic pain,
particularly when you're also noticing dryness issues, that's when you need to push for a comprehensive autoimmune evaluation. Let's talk about something that affects up to 90% of people with Sjogren's, but rarely gets the attention it deserves: fatigue. Not regular tiredness, not the kind where you had a long day and need to crash on the couch. We're talking about profound, bone-deep exhaustion that doesn't improve with rest and doesn't match your activity level. This stems from multiple factors. Chronic inflammation drains your energy. Poor sleep quality because of dryness symptoms means you're never truly resting. And there might be direct autoimmune effects on the brain that we're still learning about. People describe feeling like they have the flu constantly, this heavy exhaustion that comes and goes unpredictably. Alongside fatigue, there's often brain fog, memory problems, difficulty concentrating, trouble finding words, slower processing speed. People forget appointments, lose their train of thought mid-sentence, struggle to follow conversations the way they used to. These cognitive issues can be just as disabling as the physical symptoms, sometimes more so. And they often appear before other obvious signs of Sjogren's. Both men and women experience this, though women might report it more frequently. The challenge is that fatigue and brain fog are subjective and hard to measure, so they're often dismissed by doctors as stress or depression. But recognizing them as legitimate symptoms of Sjogren's is crucial for proper care and improving quality of life. Finally, let's circle back to the symptom that pairs with dry eyes as the classic hallmark of Sjogren's: dry mouth or xerostomia. Unlike temporary dryness from dehydration or certain medications, Sjogren's related dry mouth is relentless. Your mouth feels cottony or sticky all the time. Normally, you produce between 1 and 1.5 liters of saliva every single day. With Sjogren's, you might produce less than half that amount. This makes chewing difficult. Swallowing becomes a challenge. Speaking clearly gets harder because your tongue sticks to the roof of your mouth. Without saliva's protective enzymes, antibodies, and minerals, your entire oral environment shifts. Bacteria and fungi grow unchecked. Your pH balance shifts. Your tongue swells and cracks. You developed painful fissures at the corners of your mouth. Everything from eating to talking to sleeping becomes uncomfortable. Research shows that while both men and women experience xerostomia, women tend to report more severe symptoms and earlier onset. Men might initially blame it on lifestyle factors like smoking or drinking, potentially missing the underlying autoimmune process. But regardless of gender, persistent dry mouth combined with difficulty swallowing or frequent dental problems warrants a thorough medical evaluation. So here's where we stand. We've covered 12 warning signs that often slip through the cracks for years. Autonomic dysfunction affecting your heart rate, blood pressure, and digestion, severe dry skin and unusual rashes, Raynaud's phenomenon with those dramatic color changes in your fingers, a chronic dry cough that won't respond to normal treatments, persistent dry eyes that go beyond simple irritation, rapidly progressing dental decay and oral infections, chronic nasal dryness and sinus issues, complex gastrointestinal symptoms from reflux to gastroparesis, vaginal dryness for women and chronic prostatitis for men, profound fatigue paired with cognitive dysfunction, and classic dry mouth that fundamentally changes daily life. The pattern you should be watching for is persistence and combination. One symptom alone might not mean much, but when you're dealing with several of these, especially the dryness issues affecting multiple systems, that's when alarm bells should ring. If you've been bouncing between different specialists trying to solve what seem like unrelated problems, if you keep hearing, "It's just stress," or "It's just aging," but nothing improves, if treatments for individual symptoms aren't working, then it might be time to look at the bigger picture. Sjogren's syndrome is real. It's serious, and it deserves proper diagnosis and treatment. The average of nearly 5 years to diagnosis isn't acceptable when early intervention can make such a difference in outcomes and quality of life. You know your body better than anyone else. Trust your instincts when something feels wrong. If what you've heard today resonates with you, take this information to a healthcare provider, preferably a rheumatologist who specializes in autoimmune conditions. They can run specific blood tests looking for antibodies, perform tear and saliva production tests, and potentially do biopsies of salivary glands if needed. Diagnosis isn't always straightforward, but being armed with knowledge about what to look for puts you miles ahead. And here's the thing, even if it's not Sjogren's, these symptoms still deserve investigation and treatment. Chronic health issues that impact your daily life should never be dismissed or normalized. You deserve answers, you deserve proper care, and you deserve to feel better. I hope this has been eye-opening for you. If you found this information valuable, if it connected dots you didn't know needed connecting, or if you think someone you know needs to hear this, please share it. Hit that like button so more people can discover this content. Drop a comment below. I'd love to hear if anything resonated with your experience or if you have questions I can address in future content. And most importantly, subscribe and turn on notifications so you don't miss future videos where we dive deep into health topics that matter. Knowledge is power, especially when it comes to your health. The more you understand about how your body works and what warning signs to watch out for, the better equipped you are to advocate for yourself. Stay informed, stay curious, and take care of yourself. Until next time.